Hi, welcome to the Herbal Hour. I'm your host, Stephen Horn, and today's topic is pain relief without medication, the simple secrets to relieving pain the natural way. I think this is probably one of the most interesting and valuable topics that I could address, because obviously the reason why we seek help when we're sick is because we want to be free of pain. I mean, pain is basically the universal symptom of disease or human suffering. And the desire to be free of pain is basically the main reason why we seek out help with our various illnesses and problems. So in order to understand what I'm going to teach you today about how to relieve pain, first of all, we need to understand a little bit better about what pain is. So let's look first of all at what causes pain. Pain is one of the 4 symptoms of inflammation. And inflammation is the body's reaction to tissue damage. So basically, pain is a message that tissues have been damaged and something is wrong and needs to be fixed. Most of us regard pain as sort of an enemy, as something that should be killed or destroyed or fought against. But if you didn't experience pain when you touched a hot stove, or you smashed your finger, or you did something else to damage your body, you wouldn't learn to be careful not to damage your body. Imagine a world in which there was no pain, that you had no ability to tell when you were doing injury to yourself. You would pretty soon, cause serious, major damage and maybe even kill yourself if you didn't understand when certain things are wrong. So pain is both a warning that something is wrong, and pain is also a teacher that tells us that something needs to be changed about the way we're leading our life. Unfortunately, most people in modern society don't see pain as a teacher. They see pain as some inevitable thing that's kind of attacking them for no reason at all, and therefore something to just be relieved by popping a pill, and not by examining what they might be doing in their life with their diet, lifestyle, attitudes, and so forth that might be causing this pain. So let's look a little bit more closely at this process of inflammation. And let's start by looking at how normal, healthy cells function. So this particular slide shows a picture of some happy cells that are getting what they want. At the top of the screen is represented a blood capillary, and the little reddish-orange dots represent something called plasma proteins, albumin, globulin, and fibrinogen. The little blue dots represent water molecules. Plasma proteins attract and hold water in the circulatory system. In the capillary, little bits of fluid are pushed through the cell membranes to irrigate the cells, and there is just enough fluid to fill the cracks in between the cells and no more. Little bits of protein sometimes get pushed through the cell membranes too, but they are picked up by the lymphatic system and carried back to the main circulatory system. This very tight tissue structure allows for a very rapid exchange of oxygen and nutrients and a rapid removal of wastes from the cells. When we damage tissues, what happens is cells burst, and these cells release into the surrounding fluid chemical messengers or mediators that induce an inflammatory response. The first of these mediators are called histamine and bradykinin, and they dilate the capillary pores and allow the scenario that we see in this next slide to take place. With the capillary pores enlarged, protein is able to leave the circulatory system in large amounts, carrying with it excess fluid. This causes the tissues to engorge with fluid and causes swelling, a localized swelling of the tissues. So this actually creates the first symptom of inflammation, which is swelling. There's a very good reason why the body does this. It's in order to kind of sequester the area. Like, let's say that there's a fire or some kind of extreme hazard that happens in our community. The police will move in and basically cordon off the area to prevent people from getting too close to the area who might be damaged as innocent bystanders. Well, let's suppose that it's a toxin that's irritated the body, such as you've just been bitten by a black widow spider or bitten by a poisonous snake. The inflammatory response sequesters the area, and by slowing down the movement of blood and lymph in that particular area, it basically slows the spread of the toxin in the system. So this mechanism does have a useful purpose in protecting tissues. However, in most injuries, there really isn't that much of a problem with having to sequester the body against toxins. So there are some ways of very rapidly relieving inflammation in most minor injuries just by understanding this process of tissue swelling and what takes place. This is called inflammation, or in Latin, itis. And inflammation, as shown on this next slide, is characterized by 4 symptoms: heat, swelling, redness, and pain. We've already described what causes the swelling. The heat took me a while to understand, but the heat is actually generated by free radical damage at the site of injury. Basically, oxygen molecules kind of spin out of control in this area and burn and damage tissues, at least if there aren't enough antioxidants to prevent that from happening. In addition, the policemen and firemen of the body, the white blood cells, are drawn to the area of inflammation, and they start cleaning up the debris by secreting oxygen radicals to burn up any infection that may be present, to destroy damaged cellular materials, and otherwise sweep the area clean. This high oxidative level of activity that's taking place at the site of injury creates the heat, or the burning of inflammation. A backing up of red blood cells into the capillaries moving into this area causes the redness. And the pain, of course, is the nerves communicating the message that this area has been damaged and is in need of help. The primary reason, thing that triggers the pain mechanism, is the lack of oxygen at the cell level. By slowing down the microcirculation, there is no longer a rapid exchange of oxygen and nutrients. And the dearth of oxygen to the tissues in that site causes a trigger of the nerve impulses that basically is like calling 911. When we have an emergency in our neighborhood, we get on the phone and we call 911 to communicate that something's wrong and to call for help. Pain is the cells or tissues' 911 call to the brain that's saying, help, we need you to do something. Well, we all kind of instinctively know some things that we can do to have basic pain relief when we injure ourselves. So let's look at these. There's 3 basic things. 1 is to apply pressure, 2 is to massage the injured area, and 3 is to rub the area lightly and rapidly. These actually are all very instinctive responses to pain. Think of what happens when you actually smash your finger with the thumb, or smash your thumb with a hammer when you're trying to drive in a nail. Your first impulse is to grab hold of the injured area. That's what we all do. And this is the first secret of pain relief, is to apply pressure. So you grab hold of the injury, but what makes this work is you don't let go until the pain subsides. This typically takes between 5 and 20 minutes. What's happening is by pressing the tissues and compressing them, you are preventing fluid buildup in the tissues. Yes, the proteins move out of the bloodstream and carry fluid with them, but because the pressure inhibits fluid accumulation in the tissue spaces, this fluid is rapidly picked up by the lymphatic system and carried into the lymph nodes and so forth, where macrophages in the lymph nodes break down cellular debris. As soon as the area has been cleared of cellular debris and normal oxygenation has been restored to the tissues, the pain subsides and you can let go. The amazing thing about this very, very simple technique is the pain does not come back. There is no swelling. Usually there is no bruising. I've seen this work on extremely bad smashes and burns and all kinds of minor injuries. And basically they almost completely heal within 30 minutes to an hour with very little residual problem. Now, of course, what most people do is they're not willing to sit there and hold the thing for 5 or 10 minutes. And usually that's really all it takes is 5 or 10 minutes. So they'd rather put up with 2 or 3 days of the thing hurting and not being able to use it than to spend 5 or 10 minutes holding it and making the pain go away. One of my sons has commented to me, he just can't believe that people don't know this. And I agree. This is one of the simplest things I've ever learned, and yet it's immensely valuable. I've grabbed and held injuries with my kids, with other people, and it's something that's cheap, it doesn't cost anything, and it's remarkably effective. And it's a technique that I think everybody ought to know. Well, the second technique we're going to talk about is also very instinctive. It's massage. Think about the fact that most of the time when you have an ache or a pain or a sore muscle or whatever, you start rubbing it. Well, what does the massage do? The massage basically, again, is pumping fluid into the lymphatic system. If you keep it up typically for 5 to 20 minutes, pain is relieved. Why does massage work? For the same reason pressure works. Massage is just basically a kneading of the tissue that pushes that excess fluid out of the tissue spaces, moves it into the lymphatic system, clears the area of cellular debris and so forth, and as soon as normal circulation and oxygenation are restored to the tissues, the pain goes away. Again, the secret is to do it until the pain stops. One of the techniques, I've learned these techniques, by the way, from Dr. C. Samuel West, president of the International Academy of Lymphology. And I worked with him for almost a year, and it was just one of the most valuable things I ever did in learning these techniques. For example, if you take and sprain your ankle, and as soon as you feel the sprain, you get down and you immediately start massaging the ankle. Yes, as Dr. West said, it's going to hurt, but it's going to hurt anyway. So you just keep rubbing it and rubbing it and rubbing it, rubbing it, rubbing it, and typically within about 15 to 20 minutes, suddenly the pain will subside and the ankle will be completely free of pain. I did this once when I was hiking off of a very high mountain in Utah, Mount Timpanogos. It's 6 miles up and 6 miles down, and as I was coming down this very steep trail, I stepped wrong and twisted my ankle. It wasn't very bad, but it was enough to cause me a little bit of limp, and I had 3 miles to go. I sat down, pulled off my hiking boot, which was something that Boy Scout manual said never to do because the pressure of the boot helps hold down the swelling. But I did, and I started massaging the ankle. 15 minutes later, I was completely free of pain and able to complete the rest of the 3-mile hike without any further pain or problem. I also used a remedy in my first aid kit that I had with me, which I'm going to tell you about later, called arnica, which reduces swelling and is a very effective remedy for inflammation. At the time I was working with Dr. West, a chiropractor who was working with us was coaching a young men's basketball team for his church. And one of his star players in the first quarter sprained his ankle. The coach spent the second quarter massaging the ankle until the pain and swelling subsided, wrapped it up, and the kid was able to play the last half of the game without any further problem. Now, of course, when you have tissue damage, you do need to be careful. The area has been a little weakened, and it actually takes a couple of days for it to fully knit back together, but which is why he wrapped the ankle. But I've seen this technique also work wonders for relieving pain. Our third technique is light, rapid stroking. This is something that mothers often instinctively do with their children. You move your hand rapidly back and forth over the area of injury, and again, continue until the pain subsides, which is usually 5 to 20 minutes. This technique is very simple. You just basically go like this, very quickly, back and forth. What's really interesting is you can actually do this not touching the body, just going like this, and it will still relieve the pain. I'm going to explain why a little bit later. But this also pumps lymph fluid out of the area and makes it go away. One time my youngest daughter had a severe whack to her leg, and there was a very large red welt about this big that appeared on her leg. And she was crying, and I took her in my arms and I said, let's make it go away. And I started doing this very light, rapid stroke, and I said, we're going to rub the pain away. Within about 1 to 2 minutes, she stopped crying. And I watched, as I rubbed, literally watched that red welt grow smaller and smaller and smaller and smaller until it disappeared and was completely gone in 5 minutes. No bruising, no further injury, the pain completely relieved. I have done this technique with sore throats. I've used these techniques to help, with earaches. There are numerous applications to these techniques if you understand that pain involves inflammation. So all minor injuries, bumps, bruises, sprains, burns, etc., can use these techniques. I've used them on headaches by working on people's neck and shoulders and temples and so forth. I've used it on muscle and joint pain. I've used it on sore throats. I've used it on earaches. Numerous applications of this technique, these simple techniques. The trick is that most people in our society are so impatient that they would rather pop a pill and suffer for a few days than they would to stop and spend 5 to 15 minutes to make the problem go away for good. That to me is just very, very unfortunate, because one of the things I've noted, especially in families, is when we have this attitude that popping pills is the solution to our problems, think of the message that sends to our children about drugs. That if you're in pain, if you're distressed, pop a pill. Whereas if distress or pain means you seek out another person and you get massaged or you get rubbed or you get held and comforted for a little bit while this process takes place, there's a bonding that takes place. Being able to relieve pain from your children, from members of your family, from your friends is a great gift. And if you practice these techniques, you'll actually become very good at them in a very short period of time. Now, these techniques can all be enhanced by the use of certain topical remedies that speed the process of getting rid of inflammation. One of these remedies is Nature's Fresh, which I like to call the miracle worker in a bottle. Also, I'm going to tell you how to make magic flower water, which is another great topical pain remedy. And I'm going to also talk about topical analgesic oils and healing AC cream. So let's look at the first of these, Nature's Fresh. Nature's Fresh is an enzyme spray. And we have a lot of people who've used it for a wide variety of problems: arthritis, back pain, bites and stings, breast pain, bumps and bruises, disc problems on the back, fibromyalgia pain, muscle pain, sprains and pulls, sunburn, and other burns. Basically, I'm not sure exactly why this works, but Nature's Fresh was basically originally designed as a deodorizer and stain remover. It contains 6 different classes of enzymes that break down organic molecules. But these same enzymes catalyze biological processes, and they appear to be able to speed up the body's ability to heal an area of inflammation or damage. So by spraying Nature's Fresh on the injured, damaged, or painful area, and then applying the rapid light stroke, the pressure, or the massage, you can actually speed up the time it takes to get the pain to subside and the injury to start to heal. Another great little thing that you can use is magic flower water. Basically, this involves adding 10 drops of distress remedy, which is a flower remedy, or you can use the Bach flower rescue remedy to a pint of water, although I find distress remedy actually works better because it has more tissue healing homeopathics. You can spray this water in a spray bottle on injuries, bites, stings, bruises, sprains, swellings, etc. You can also take this distress remedy straight, undiluted, to help treat shock and help recover from injury, or you can apply the undiluted distress remedy directly to an injury. It doesn't sting, it doesn't hurt. One time, a friend of mine, the daughter of a friend of mine, fell off her bicycle and had multiple scratches, bruises, and abrasions on one side of her body, on both her leg and her arm. I think it was on the left side. And I grabbed a bottle of the magic flower water spray, went over there, started misting the area with water and using the rapid light stroke without touching touching her body while I was working on all these injuries. My oldest son came over and actually started working on her too, copying what I was doing, and I just kept misting the side of her body with this stuff and doing these pain relief techniques, and in 30 minutes there was no pain in her body whatsoever, and all those injuries healed extremely rapidly. This is an amazing little technique and a wonderful way to ease pain. I've also used essential oil blends that are topical analgesics to speed up this process. You use these basic techniques, particularly massage, with like Thai Fu essential oils or Typhoon massage lotion, deep relief oil, or Everflex cream. As you apply these topical analgesics, they actually have a kind of pain relieving effect. That is, they bring blood to the area, they help promote lymph drainage, they actually bring energy that promotes healing to the tissues, but they all contain substances that actually kind of numb the nerve endings a little bit. So you get a faster pain relief, but by continuing with the massage and so forth, you're able to actually remove the underlying cause of the pain, which is to clean up the area from the excess fluid and cellular debris that's taking place there. There's one more remedy I want to talk about, and that is arnica. Arnica is just an amazing substance. It's used homeopathically to promote the healing of bruises, swellings, and other inflammatory processes, and it's used where the skin is not broken. I keep arnica homeopathic in my first aid kit at all times, both to take orally and in a form to apply topically. A good product that I like is Healing AC Cream, which is an arnica calendula cream. Calendula is useful for cuts and so forth, and this has numerous uses: bruises, sprains, tired and aching muscles, wound healing, dislocations, bruising, phlebitis, thrombosis, insect bites, etc. Anytime you have any kind of tissue damage where there is swelling of the tissue, where the skin is not broken, this is not something you apply to cuts. Arnica is typically not applied to anything where you break the skin with a cut, but any tissue damage where the skin has not been broken, you can apply the Healing AC Cream to. It works just like that rapid light stroke to bring down the swelling, bring down the inflammation, and rapidly heal the area. Arnica, of course, is what I took when I worked on my own sprained ankle. Now let's move on to the issue of chronic pain. Mostly what we've been talking about up to this point is injuries. But chronic pain is the result of long-term tissue damage and is a sign of chronic inflammation or chronic irritation to the tissues that is basically going on for a long period of time. Like the pain of acute injuries, chronic inflammation has a cause. Something is damaging the tissues. What I'm going to be talking to you about in the rest of this video is techniques for helping to ease the pain. Many of these techniques actually are helping to deal with some of the underlying causes why this chronic inflammation is present in the body. However, I am not going to cover all of the possible causes of why the body may be suffering some kind of chronic damage. The chronic damage could be coming from stress. It could be coming from mechanical damage, poor posture, repetitive movements such as sitting too much at a computer and typing hunched over like this can cause damage to the tissues because it causes irritation to joints and so forth, particularly if you don't have enough nutrients to keep those joints healthy and strong. It could also be caused by toxins that you're being exposed to. So it's always important to look for the underlying causes of why you're experiencing pain. And we're going to talk about some of these underlying causes. But first, I want to talk about anti-inflammatory drugs. The most common pain relievers people use are non-steroidal anti-inflammatory drugs and COX-2 inhibitors, and also steroidal anti-inflammatory drugs, which are prescription medications. We're going to look at each of these. But first of all, let's talk about the general problems of using drugs to relieve pain. The biggest problem is these drugs are often used to mask symptoms, ignoring the warning sign that something is wrong. So people, get a headache and they just pop a painkiller, but they never stop and think, why am I getting headaches? They also have serious side effects when overused. So what happens is a lot of people who say have chronic headaches or arthritis pains or so on and so forth will pop these painkillers routinely in order to relieve the pain, never stopping to figure out why are their joints inflamed, why are they getting headaches, and by taking these pain medications over periods of years, they actually cause further tissue damage to their body because these drugs are toxic. Let's look first of all at non-steroidal anti-inflammatories. These work by inhibiting certain prostaglandins that are pro-inflammatory. and therefore reduce inflammation. Remember, there are chemical messengers that mediate inflammation. The first are histamine and bradykinin, but there's other ones that maintain a more chronic state of inflammation. And this inhibits those inflammatory chemicals, which actually can help to relieve them. Non-steroidal anti-inflammatory drugs include aspirin, which was one of the first compounds developed here, plus other things like acetaminophen, Tylenol, so forth. These drugs actually are not without side effects. Well, I would say that aspirin is not a really dangerous medication used occasionally, and even probably Tylenol is not all that dangerous if it was used occasionally. But if used long-term, here are some of the possible side effects of these medications. Kidney and liver damage. Many people on kidney dialysis are actually there because of overuse of acetaminophen. Also, liver damage can happen from large doses of acetaminophen. My friend Kimberly Ballas lost a kidney because in her roller skating, whenever she got damaged, they would give her large doses of acetaminophen and it destroyed one of her kidneys. Ulcers are a common side effect of overdoses of aspirin and so forth. Renal failure, allergic reactions, occasionally they can cause hearing loss, and they also increase the risk of bleeding and hemorrhaging. There are some natural alternatives to non-steroidal anti-inflammatories. These are herbs that are basically natural forms of aspirin or salicylates. These are the compounds from which aspirin was originally derived. Herbs that contain salicylates include willow bark, poplars of various kinds such as balm of Gilead, cottonwood, and quaking aspen. Black cohosh contains salicylates, clove buds, meadowsweet, and wintergreen. So there you have a depiction of, on that slide, you had white willow, which has been used since the time of Hippocrates in Greek medicine for arthritic pains and so forth as an anti-inflammatory agent. I personally find that natural anti-inflammatory compounds that contain natural aspirin-like compounds have fewer side effects than the drug non-steroidal anti-inflammatories and are safer for long-term use. They aren't quite as strong because they're not quite as concentrated, but in a lot of cases, they're enough to take the edge off the pain while you work on helping to heal the deeper underlying issues that are causing the pain. One of the herbs that's really helpful here, just to highlight one of them, is black cohosh. Black cohosh is an antispasmodic, which means it relaxes muscle spasms, but it's also an anti-inflammatory containing salicylates. It's been used to treat whiplash, arthritis, rheumatism, tension headaches, cluster headaches, neuralgia, that's inflammation of the nerves, and muscle spasms, even things like asthma attacks. So black cohosh is just one example of one of these natural forms of aspirin, and a very, very useful one. A formula that is useful for this is a kind of the natural aspirin formula, call it the herbal aspirin, is APS2 with willow bark. This is a formula from Stan Malmstrom. It reduces inflammation, helps reduce fever. It's useful for arthritis and headaches in much the same way as aspirin or acetaminophen. It contains willow bark, wild lettuce, which is a very good relaxant, valerian, which is also relaxing and calming to the nerves, and capsicum, which stimulates circulation. It isn't as strong as aspirin, but again, it's, in my experience, safer, and it's enough often to take the edge off of the pain and make it tolerable. Another formula that's very similar to this is called Nerve 8. Nerve 8 is also anti-inflammatory and relaxing. It's helpful for headaches, arthritis, neuralgia, and muscle aches. It contains white willow and black cohosh as two forms of natural salicylates, valerian and hops, which are sedative and relaxing to calm the nerves, wood betony and devil's claw, which are anti-inflammatory, and again, capsicum to stimulate circulation. The next class of anti-inflammatory drugs are COX-2 inhibitors. COX-2 inhibitors inhibit, it was found that there were two forms of these prostaglandins that mediate inflammation. They were called COX-1 and COX-2. By inhibiting COX-2, you got some of the anti-inflammatory pain relieving effect with less problems with bleeding, less risk of ulcers, and so forth. There are a number of derivatives of, these are derivatives of the other non-steroidal anti-inflammatories. Some of the most popular have been Vioxx and Celebrex. These actually do have some side effects, even though they have fewer side effects than the regular non-steroidal anti-inflammatories. They were found to increase the risk of blood clots, heart attack, and stroke due to a decrease in the release of clotting factors. I actually don't know how to pronounce that drug name properly. Rofecoxib, which is basically, I think, the Celebrex. Not Celebrex, the Vioxx and so forth, had to be withdrawn from the marketplace after about 5 years because it caused this increased risk of problems. Celebrex is actually still on the market. It's very possible, again, that these drugs taken, occasional pain relief, one thing, taken over extended periods of time is where you're likely to get these problems. There is a natural alternative to COX-2 inhibitors. It's a formula called triple relief. It's useful for arthritis and back pain. It contains Nexertin, which is a natural COX-2 inhibitor that's extracted from a plant, Boswellia and white willow, which are anti-inflammatories and again have some natural salicylate action. Even this formula I would not consider using as a constantly for relief of pain, because again, remember, pain has a cause. We've got to go find out what the cause is. However, this is a pretty good alternative for helping to ease the pain while you're working on some of the deeper underlying causes of why you're experiencing pain. Last of all, let's talk about steroidal anti-inflammatories. These are a class of drugs that mimic the adrenal hormone cortisol and other forms of corticosteroids that are produced by the adrenal glands. These drugs are very, very good at reducing inflammation and easing pain, but they have numerous side effects. Prednisone is an example of this class of drugs. Common side effects of long-term use of these drugs include loss of bone, osteoporosis, development of cataracts, the increased risk of infection because they depress the immune system, swelling and weight gain, high blood pressure, and problems with bone marrow in the production of blood cells. So these have some really serious side effects. They can work wonders as temporary relievers of very serious inflammatory processes, but used constantly, they run the risk of very serious side effects. Now, there are, of course, some natural remedies that have similar cortisone-like activity. So some of the remedies that have this include wild yam, licorice root, yucca, and since the adrenals are what produce this, taking an adrenal glandular that builds up the strength of your adrenals, such as adrenal support, can also help your adrenals produce more natural cortisol to reduce inflammatory activity. These remedies are useful for chronic pain like arthritis, asthma, autoimmune disorders, and severe injuries. One of my favorites is yucca for autoimmune disorders. Yucca is a mild, well, it's actually not mild, it's a blood purifier, meaning it helps to detoxify the blood, and it is also an alkalizing agent. It actually contains natural saponins, natural soaps, so it sort of acts like a detergent to clean out the system and cool the blood and alkalize the system. We'll talk more later about alkalizing the system and why it's so important. These other two remedies, first is licorice root. And licorice root is a very, very good anti-inflammatory remedy. It's good for arthritis, tendinitis. It's very good for intestinal inflammation, ulcers, useful for sore throats, especially if you suck on the powder. And it can be helpful for autoimmune diseases too. Licorice root has one drawback with some people. It does tend to aggravate fluid retention and high blood pressure. So if a person has a tendency to edema and high blood pressure, licorice root would not be the best choice. However, it does help to balance blood sugar levels, and I find it to be a very good remedy for children or people who crave sugar a lot. The other one is wild yam. Wild yam is both antispasmodic and anti-inflammatory, so it relaxes muscle cramping and pain. It's also very good for digestive irritation, diverticulitis, adult colic, pains in the intestinal tract. It's very good for women who have menstrual cramps and pain, painful bowel spasms, and pain in the urinary tract. The drawback of wild yam is it tends to be hormonal. In fact, both licorice root and wild yam have some hormonal effects, which yucca does not. But any of these can be used as a way of helping people to get this cortisol-like effect without using corticosteroid drugs. Because these herbs actually tend to potentize the natural cortisol in the body, they will kind of potentize corticosteroid drugs. They'll make them last longer in the system. So if a person's going to start using these, you would need to adjust the dose downward of the corticosteroid drug and kind of use this as a weaning off approach to getting a person to change over to a more natural remedy. In all of these natural remedies we've talked about for the non-steroidal anti-inflammatories, the COX-2 inhibitors, and the cortisol-like remedies, keep in mind that the natural remedies do not work as fast and are not as strong as the drugs. This means that you may need to be a little bit patient, take a little bit more in the beginning to kind of get the process started and then reduce the dose, and realize that they may take the edge off the pain, ease it to a certain degree, but may not completely eliminate it the way the drugs do. However, they have a more cumulative positive effect and much fewer side effects, and so they're much safer for long-term use. Generally speaking, what I find you need to do is start off taking like 2 capsules every 2 hours until they start kicking into effect, and then you can usually reduce the dose to like 2 capsules 3 times a day. But now let's look at natural approaches to pain relief that involve actually working on the underlying root causes. So let's look at some of these causes of pain, chronic pain anyway. Of course, chronic inflammation, which we've already indicated. Lack of oxygen. Remember, pain at its most fundamental level is usually a lack of oxygen in the tissues. Dehydration, overacidity, and kind of a general toxicity of the system. Muscle cramping and tension, and congested lymphatics. Now, all of these are kind of interrelated, but we're going to look at each one of them individually. So one of the best approaches to chronic pain relief is to start using natural anti-inflammatories such as IF Relief, Super Orac, Tygo, IFC, or Super Omega-3. All of these remedies are designed to help reduce chronic long-term inflammation and promote healing of the tissues. Many of them are high in antioxidants, which basically, if you understand that the heat at the inflammatory site is generated by this oxidative stress that's taking place there. By getting antioxidants into the body, it helps protect the surrounding tissues from collateral damage. In other words, it helps think of it as like there's a shootout taking place in the neighborhood, and the antioxidants protect the innocent bystanders from getting shot. So basically, that helps to keep inflammation from spreading, kind of sequesters the inflammation, cools down the area, and helps the healing process. The first of these remedies is one of my favorites for pain. It's called IF Relief, and it contains turmeric, mangosteen xanthones, boswellia, white willow, and andrographis. This remedy is a phenomenal anti-inflammatory, and I have had some great success with it for pain. I had to have a tooth pulled because the tooth cracked underneath the crown and became damaged to the point that it couldn't be repaired and had to be pulled out. I did not take pain medications. I took 2 of the IF Relief every 2 hours for about 6 to 8 hours, and after that 2 to 3 times a day, and I never needed any other pain medication. It actually promoted rapid healing. My office manager, Darla, had some dental surgery, and after about a week, there was still a lot of inflammation and pain. She'd been taking some regular painkillers. I suggested she do the same thing. When she took the IF Relief, not only did it rapidly take down the pain and swelling, the dentist was really surprised at how rapidly it healed. This combination actually helps to speed the healing of the tissue, not just ease the pain and the inflammation. Here are some of the potential uses for IF Relief: bronchitis, ear infections, gastritis, gingivitis, headache, hepatitis, of course, any kind of chronic inflammation, pain after dental work or surgery, leaky gut syndrome, neuritis, nephritis, phlebitis, sore throats, and joint pain. Another good antioxidant remedy that could be used for reducing chronic pain is superorac. This contains green tea extract, which is polyphenols, mangosteen xanthones, which are highly anti-inflammatory but also very good at relieving pain, turmeric, which is an herb that has been shown to have some very good pain-relieving qualities, and acacia berry, a very highly antioxidant berry. Another potential antioxidant remedy that can help relieve chronic pain is Tigo. Tigo contains mangosteen, grape seeds, skins, which are antioxidant, wolfberry or lycium, which is used to cool heat or inflammation, sea buckthorn, green tea, and raspberry. Again, we're dealing with something that reduces oxidative stress and damage, which helps to not only take down chronic inflammation, but also helps to promote healing of chronic inflammation. Another really important remedy that can take down chronic inflammation and promote tissue healing is omega-3 essential fatty acids. And this next chart shows a little bit about why this works. There are two basic kinds of unsaturated fatty acids, polyunsaturated fatty acids, omega-6s and omega-3s. Omega-6s can basically be converted down into two pathways. One is the series 1 prostaglandins that reduce inflammation. The other one is going down to arachidonic acid, which produces pro-inflammatory essential fatty acids. Basically, initially, you have the inflammatory response to protect the tissues, and then it switches to an anti-inflammatory response to promote healing. When you don't have enough omega-3s, the omega-6s don't go down the pathway to promote healing. So by upping your omega-3s, you actually up the level of tissue healing, anti-inflammatory prostaglandins that mediate inflammation and pain and actually start initiating a healing process in the tissues so that the inflammation just doesn't stay chronic. So here's another graph. This next slide shows the same thing, showing the omega-3s and the omega-6s. This is probably a little hard to read, but the pathway that produces the arachidonic acid and produces the prostaglandins that promote inflammation is inhibited by omega-3s, and it's activated by high insulin levels. And that's very important to understand, because eating a diet in a lot of sugar and refined carbohydrates is going to increase chronic inflammation in your body and contribute to chronic pain. So here is your strategy for altering prostaglandin production naturally. Increase your intake of omega-3 essential fatty acids and decrease your intake of omega-6s. Most people are getting way too many omega-6s and way too few omega-3s. Most vegetable oils, with the exception of, let's say, olive oil, are high in omega-6s. So you want to basically reduce most of your vegetable oil intake. You want to avoid refined carbohydrates to avoid spiking insulin, and increase your fruit and vegetable intake to increase the amount of antioxidants you're getting in your diet. This strategy goes a long ways to reducing general aches and pains and chronic inflammatory responses in your body. In other words, decrease those simple carbohydrates in favor of complex carbohydrates in the form of fruits and vegetables, and alter your fatty intake so that you're getting more omega-3s and less omega-6s, which probably includes taking an omega-3 supplement. Things that actually work directly on these prostaglandin processes and inhibit the prostaglandins that are pro-anti-inflammatory include the omega-3s, triple relief, APS2, and NERV8. All of these are working on these prostaglandin intermediators. Another formula that can really be helpful for easing chronic inflammation is IFC. It's a Chinese formula for reducing heat, fever, and inflammation, and I've found it helpful for earache, sore throat, sore gums, and other forms of inflammation where there's redness and pain. It's indicated where the tongue is red and pointy and the pulse is rapid and floating. Our next chronic cause of chronic pain is congested lymphatics. Chronic inflammation will congest the lymphatics, causing tissue swelling that can't, well, first of all, remember that the swelling goes away from the tissues through the lymphatic system. So when your lymph nodes become overburdened and congested and get swollen, the inflammation can't come down. So helping the lymph to move and reducing the swelling in lymph nodes helps reduce both chronic inflammation and pain, and it helps both in acute and chronic illness. So let's take a look at the next slide, which is of the lymphatic system. Lymphatic system basically has all these little lymph nodes. You see all those little green dots. These little lymph nodes are like sewage treatment plants. As this debris comes from the cells into these little lymph nodes, macrophages work on it to break it down. You'll have a lot of times get swelling of the lymph nodes down in the abdominal area or the groin area, under the armpits, through the chest, up in the throat, and so forth. And when you get these swollen lymph nodes, it actually is inhibiting your ability to relieve pain and reduce inflammation. So the same mechanical techniques that we learned for working on acute pain will also work on chronic pain by relieving lymphatic congestion and moving lymph. The secret is, if you can relieve the pain using pressure massage or stroking, you probably can heal the injury. You can heal the problem. The secret is to massage often enough that the pain doesn't come back. So let me tell you a little story about my knee. About 30 years ago, my knee was injured in a moped accident. My knee was broken into three pieces. The doctors didn't x-ray my knee, even though I complained that it was hurting me. This was a military hospital. This never would have happened in a civilian hospital. But 2 weeks later, when they found my kneecap had been broken, the doctor said it had a lot of damage because it hadn't been, dealt with early on. And he told me that the chances were better than 90% that my knee would never be normal again, that I would develop arthritis in it in a very short period of time, and that I would wind up having to have a knee replacement. For about 4 years, this prediction of the doctor appeared that it would be accurate. My knee was constantly sore, which again is arthritis, inflammation of the joint. Just bumping it could cause excruciating pain. I remember one time I was trying to slide into the seats in a movie theater, and I just bumped my knee against the edge of the seat, and I just about doubled over with the pain. I could not run anymore because it hurt so bad. And this went on for about 4 or 5 years. I don't remember the exact length of time, until I went to work for Dr. C. Samuel West at the International Academy of Lymphology. And he said, if you can make the pain go away by rubbing it, you can get it to heal. What he explained is that when the tissues have been stretched from chronic inflammation, it's like they have lost their elasticity. So fluid and protein readily move back into the injured area. So you rub it, it feels better because you take the swelling down. But then what happens is because the integrity of the tissue has been compromised, it rapidly swells up again. So the healing process is inhibited because of this tendency for this tissue to remain chronically swollen. It can't get a good supply of blood, oxygen, and nutrients. It can't get good removal of waste. Therefore, it doesn't heal properly. So what he said is, the secret is to rub the injury before the pain returns. If the pain returns in 3 hours, rub the injury every 2 hours. By keeping the tissue compacted and keeping the fluid out of the tissue spaces, you maintain the flow of oxygen and nutrients to the tissues and the removal of waste. This allows the tissue to begin healing, particularly if at the same time you take nutrients internally that promote tissue healing to help heal the damage to that area of the body. So what I did is I started massaging my knee as often every day as I could. I would sit there and rub my knee, and I could feel this fluid around the kneecap, and I would massage it until all that fluid was gone and the pain was completely gone. And then what I would do is every couple hours I would massage it again. And I did this for about 1 month. And at the end of a month, my knee was pain-free and I could run again. This has been, like I said, about 30 years ago. I occasionally get a little bit of achiness in my knee, which I start massaging it and doing some things. Usually that happens when I'm not eating very well and I'm under a lot of stress. But basically, if I start rubbing my knee again, sometimes applying some of the things that help work on it topically, as well as taking things internally, it pretty quickly goes back to where it's okay again. And so for 30 years, I've managed to beat the odds of what the doctor said was going to be an unhealable problem. Helping to take remedies that drain the lymph system can be very helpful in healing chronic pain. Two really good remedies are lymphatic drainage formula and kidney drainage formula. By mixing 1/2 to 1 teaspoon of both of these in a quart of water and sipping it throughout the day, it'll keep your lymphatics moving. You can also use Lymphomax, and I also find that applying the extracts of capsicum and lobelia topically, capsicum brings in blood, lobelia promotes lymphatic drainage, will greatly help this. Also, you can use other things to massage on there, like Typhu oils, Everflex cream, anything that has a topical analgesic action. But again, the secret is to rub it frequently. Capsicum is a great pain reliever because it brings blood and oxygen to the tissues. But capsicum also contains capsaicin, which actually blocks pain receptors to ease pain for about 1 to 2 hours. So applying capsicum topically not only brings blood and nourishment to the tissues to help heal it, it also helps numb the pain. If you apply the lobelia and capsicum again, like every 2 to 3 hours, and keep up with the massage, you might be amazed in 2 or 3 weeks to see how much healing can actually take place, even in old injuries. Capsicum can be useful for helping with shingles, leg and foot pains associated with diabetic neuropathy, rheumatic and arthritic pains, post-surgical pain, and chronic itching. This is taken internally. So capsicum is often included in herbal pain relieving formulas. Let me tell you another little secret to chronic pain relief through moving lymph. What happens when you have an injury is the protein moves into the tissue spaces. One of these proteins is called fibrinogen. Fibrinogen is responsible for helping to form blood clots. So it forms a network of fibers that catch red blood cells and clot the blood so you don't bleed to death. When fibrinogen gets into the tissue spaces and the electrical activity of the tissues diminish, fibrin clots, forming a kind of clotted effect in the tissue spaces that chronically holds fluid into that damaged tissue. When you apply an electrical field to this area, it breaks up the clotted protein in the tissue spaces and allows it to move into the lymphatic system. So basically, using any kind of a piezoelectric device that gives a little static electric spark will break up clotted proteins and move them out of the tissue spaces. I've also seen little devices that apply a repeated mild electrical shock to tissues. These are incredible devices for helping to get started in relieving chronic pain by breaking up this clotted protein. Some of the herbal remedies that we apply topically, I think, actually help in a similar way to electrical stimulation. Massage therapy is another great strategy for chronic pain relief, again, because it relieves stress, relaxes muscles, and helps to promote the flow of lymph to reduce inflammation. The next technique is deep breathing. Deep breathing is probably one of the most important techniques for chronic pain relief. People who are in chronic pain tend to be shallow breathers, and pain is a sign of a lack of oxygen at the tissue level. By breathing deeply, you flood the body with oxygen, and you also pump the lymphatics because deep breathing pumps lymph. This technique has helped a lot of people with chronic pain to greatly reduce the pain. Practicing deep breathing for 5 to 10 minutes, 2 to 3 times a day, you may be surprised at how rapidly that can diminish pain and promote healing. I've led people through deep breathing exercises and seen it lower their blood pressure, get rid of headaches, get rid of muscle pain, joint aches, all sorts of things. Closely related to this is water. To move toxins away from the tissues and help the body get rid of the toxins that are irritating the tissues, you need to increase your water intake. Oftentimes, just increasing your water intake so that you're getting at least a half ounce of water per pound of body weight per day is going to ease pain and suffering. Most people are drinking very acidifying beverages, coffee, tea, soda pop, and so forth, and all these energy drinks are all very acidifying. And over-acidity is another cause of chronic pain. Acid wastes in the tissues inhibits oxygenation, sorry about that, and alkalizing the body removes this acid waste and eases pain. Basically, acidity is a sign of toxicity and lack of oxygen. The ways you can alkalize your system include deep breathing, surprise, 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 drinking more water, preferably water that is alkaline in pH. In other words, if you can drink water that has a higher pH, that's more alkaline, it will neutralize more acid waste in your body and relieve pain. A diet of 70% fruits and vegetables and only 30% protein and grains will also help to alkalize your body. And a good way to test if over-acidity is causing your pains is to do a lemon water fast or a juice fast for several days. Basically, you make a natural lemonade from fresh squeezed lemons and a little bit of real maple syrup, preferably grade B or C. And you do nothing for 2 or 3 days. You don't eat anything. You just drink the lemon water. Or if you have a juicer, you can juice fresh fruits and vegetables and drink nothing but fresh fruit and vegetable juices for several days. My mom came down with rheumatoid arthritis, and I used juice fasting to help cure her, help her cure of this and alkalizing her system to do this. If juice fasting for several days eases your arthritis, eases any of the aches and pains in your body, that is a sure sign that the reason you're having chronic pain is because your system is over acid. And if you take steps to start alkalizing your system, your pain will go away. Liquid chlorophyll is one of the many remedies we have that helps alkalize the body. By adding liquid chlorophyll to your body, it increases the oxygen carrying capacity of your blood, helps build up healthy blood, alkalizes your tissue, actually acts as a natural deodorant to eliminate body odor. It has some antioxidant effects, and that's one way to help decrease pain. Another formula I've used that alkalizes the body and removes toxic waste and can be very helpful for chronic pain such as arthritis, it's one that I gave my mother, is joint support. Many of the herbs in here, such as alfalfa and yarrow and burdock and yucca or hydrangea, are all alkalizing remedies that remove acid waste from the tissues. This also contains things like alfalfa that helps rebuild joints, several anti-inflammatory compounds, and taking this along with an alkalizing diet can relieve a lot of pain. The final cause of pain that we want to talk about is muscle tension. Muscle tension causes pain because it inhibits the flow of blood and lymph, and it also can directly put pressure on nerves and irritate them. By relaxing this tension, you can often relieve pain. This is done by using a class of remedies called antispasmodics. Some examples of antispasmodics include black cohosh, which is also anti-inflammatory, blue cohosh, kava kava is a fantastic one, lavender oil, lobelia is another great one that I use a lot for easing pain. Wild yam is both cortisol-like and antispasmodic. All of these remedies relax cramps and ease muscle tension and are helpful for pain caused by tension and stress. I want to look particularly at 2 of these remedies that are my 2 favorite antispasmodics. The first one is lobelia. This is one of the best remedies I know for relaxing cramps and easing pain. I've used it for earaches, for asthma attacks, for bronchial spasms. I've rubbed it along with capsicum into sore muscles, aching tissues, into my own knee to help it to heal. The combination of the capsicum and lobelia, the lobelia not only relaxes tension, it promotes lymphatic flow, and the capsicum brings in the blood supply. By taking small repeated doses of lobelia, it can really reduce the muscle tension and stress. The other remedy that's really helpful for this is kava kava. Kava kava is particularly good for back pain caused by muscle strain, neck and shoulder pain from nervous tension, cramps, charley horses, and pain in the kidneys. Well, that basically covers the basic techniques for relieving pain. Of course, there are a lot of other options that you have. I haven't covered all of the things that can cause pain and all of the things you can do to correct it, but I've covered most of the bases. If you understand that probably 90 to 95% of all chronic pain is caused basically by chronic inflammation that's accompanied by things like muscle tension, lymphatic congestion, overacidity, lack of oxygen, by working on these basic underlying causes of pain, you can actually get to the point where you don't have headaches anymore. When I was young, or other kinds of pains. When I was young, I used to get headaches all the time. As an adult, I almost never get a headache anymore. It's because I've learned how to work on the things that cause me to get headaches. By keeping myself properly hydrated, by deep breathing, by learning to relax my muscle tension, don't get headaches anymore. The same can be said for pains, aches and pains, upset stomachs, even joint pains like my knee. By working on the underlying causes, using some natural anti-inflammatories, and learning these basic secrets to pain relief, 95% of all pain can be dealt with in a completely natural way. There are two other causes of pain I want to mention that I have not addressed in this program. One is you actually can have pain from damage to the nerves themselves. That's an entirely different issue and is a form of pain that is very difficult to treat using the kinds of remedies that I am talking about. That requires a whole different understanding of what to do. Sometimes pressure on the nerves can be relieved with chiropractic care or massage therapy. Sometimes it requires actually rebuilding and repairing and feeding the nerves, which I didn't have time to talk about in this program today. The second cause of pain is we all know that we can experience pain from emotions. From no physical cause, just the fact that we're emotionally traumatized can cause us to experience pain. Some people's pain is caused by unresolved emotional trauma, which again is not something that I've talked about how to deal with here. Sometimes you actually have to help a person work through the emotional trauma in their life to ease their pain and suffering. Nevertheless, probably 90 to 95% of most people's pain can be eliminated using the techniques I've described in this program. So I hope that you will take and use this information and start applying it, because if you do, you'll find that there are ways of relieving pain completely and permanently without medications of any kind.